Have you ever woken up with a stiff neck, a pounding headache, numb fingers, or that strange, heavy feeling in your chest and thought, maybe I just slept wrong? What if I told you that for many older adults, that simple phrase is far more serious than it sounds? Heart surgeons and sleep specialists keep warning that the way you sleep every night can quietly place extra strain on your heart, your breathing, your circulation, and even your brain, especially after the age of 60. And the most shocking part is that many seniors repeat the same dangerous sleeping habits for years without realizing their own bed may be making their health worse instead of helping them recover. Tonight, you may be lying in a position that seems comfortable, but by morning, your body could be paying a hidden price. In this video, we're going to reveal the sleeping position that heart experts say can be especially risky for seniors, the warning signs your body may already be giving you, and the simple changes that could help you sleep safer, breathe easier, and wake up feeling more stable. Because when your heart is already working harder with age, even one bad habit repeated night after night can become a real problem. Before we begin, take a moment to subscribe, like the video, and tell us in the comments how you usually sleep, on your back, on your side, or on your stomach. Your answer may say more about your health than you think. Let's start with the position that worries many heart and sleep experts the most for older adults. Sleeping flat on your back for long periods, especially if you already deal with snoring, sleep apnea, high blood pressure, swelling in the legs, acid reflux, or any history of heart problems. Now, that does not mean every person who sleeps on their back is in danger, but for many seniors, this position can make several hidden issues worse at the same time. When you lie completely flat, gravity changes the way your tongue, soft tissues, and airway sit in the throat. In younger people, the body often compensates more easily, but with age, muscles lose tone, tissues relax more, and the airway can narrow more quickly during sleep. That means breathing may become shallower or briefly, interrupted again and again through the night, often without the person even realizing it. And every time breathing drops, oxygen levels may fall, stress hormones can rise, blood pressure may spike, and the heart is forced to work harder while the body should be resting. For someone in their 60s, 70s, or beyond, that repeated stress is not a small thing. Over time, poor nighttime breathing can be connected with irregular heartbeat, worsening fatigue, morning headaches, brain fog, and a higher strain on the cardiovascular system. This is why some heart surgeons speak so strongly about sleep posture, because they know the heart does not only suffer from what happens during the day, it also suffers from what happens silently at night. Back sleeping can also make fluid shift in ways that create more trouble. Many older adults notice swelling in the ankles or lower legs during the day. When they lie flat at night, some of that fluid can redistribute upward in the body, including around the neck and upper chest, which may make breathing even more difficult. The result may be louder snoring, more choking sensations, more awakenings, and less truly restorative sleep. Some seniors wake up thinking they slept 8 hours, yet still feel exhausted, irritable, and weak. Not because they slept too little, but because their body was under stress the whole time. And here is where it becomes even more concerning. Many people assume danger only looks dramatic, crushing chest pain, collapsing, or sudden shortness of breath. But in seniors, the early signs are often subtle. It may look like waking up tired every day, needing multiple naps, feeling slightly dizzy when standing, having dry mouth in the morning, waking with a racing heart, or needing to sleep propped up on extra pillows without really knowing why. Some people even start falling asleep in a recliner because lying flat feels uncomfortable, but they never connect that change to their heart or lungs. They simply think, this is just part of getting older. But that is exactly the trap. Too many serious symptoms get excused as normal aging when they may actually be signals that the body is struggling during sleep. Another position that can create real problems is sleeping on the stomach, which many people do not expect. Stomach sleeping can force the neck into an awkward twisted angle for hours, compress the chest, and make deep breathing feel less natural, especially in older adults with reduced lung capacity, shoulder stiffness, arthritis, or spinal issues. It may not sound like a heart issue at first, but anything that interferes with relaxed breathing and healthy circulation at night can indirectly increase strain on the whole system. On top of that, stomach sleeping often leads to sore joints, tingling hands, neck pain, and disrupted sleep cycles. So while it may feel cozy for a few minutes, it is often one of the least supportive positions for aging bodies. That brings us to the position many experts often consider the safest and most supportive for many seniors: side sleeping, especially with the body properly aligned. Side sleeping can help keep the airway more open, reduce snoring in some people, ease pressure on the back, and in many cases, improve breathing compared with lying flat on the back. But even side sleeping is not automatically perfect. If the head is too high, too low, or tilted at the wrong angle, the neck and shoulders can still suffer. If the knees are stacked painfully or the mattress sags too much, the hips and spine may ache by morning. That is why the details matter. A sleeping position is not just about whether you are on your back or side. It is also about support, alignment, breathing, and whether your body is being helped or quietly stressed for 6 to 8 hours every night. One of the most overlooked warning signs is how you feel in the first 10 minutes after waking up. That short window can tell you a lot. Do you wake clear-headed, steady and comfortable, or do you wake confused, heavy, coughing, sore, bloated, or already tired? Do your rings feel tighter in the morning? Do you notice your heart pounding? Do you have to sit on the edge of the bed before you can stand up properly? Do you wake with a bitter taste in your mouth or burning in your throat? These are not random annoyances. They can point to reflux, low oxygen during sleep, poor circulation, or a body position that is not working in your favor. Seniors with heart failure or early fluid retention often notice that lying completely flat makes them feel worse. They may feel pressure in the chest, a sense of breathlessness, or the need to prop themselves up with 2 or 3 pillows. That is not something to ignore. It can be one of the body's clearest signals that the heart and lungs are not handling a flat sleeping position well. Another important issue is nighttime trips to the bathroom. Many older adults think frequent urination at night is only about age or bladder problems, but sleep disruption from breathing trouble can play a role too. When sleep is fragmented and the body is repeatedly stressed, hormone balance changes, and nighttime bathroom visits may become more frequent. Then the person gets even less deep sleep, feels weaker the next day, and the cycle continues. Poor sleep posture can also worsen acid reflux, which is especially common after large evening meals, spicy foods, late snacks, or certain medications. When stomach acid moves upward during the night, it can irritate the throat, trigger coughing, create a choking sensation, and disturb breathing. Some people even mistake this for a heart problem because it causes chest discomfort. Others ignore it for years, not realizing their nightly sleep setup is feeding the issue. This is why heart specialists often say bedtime habits should be treated with the same respect as diet, walking, or taking medication. The body does not stop needing good choices once the lights go off. In fact, some of the most important recovery processes happen during sleep, and if breathing is strained, posture is poor, and circulation is affected, the body misses that chance to repair. Think about it this way. During the day, your heart is already adapting to age-related changes in blood vessels, blood pressure, activity level, and sometimes medications. At night, it should finally get a quieter environment. But if your sleeping position narrows your airway, encourages snoring, worsens reflux, and interrupts oxygen again and again, your heart never really gets that break. It keeps reacting, adjusting, compensating, and working. Night after night, that burden adds up. And for some seniors, the difference between waking up refreshed and waking up drained can come down to a few simple changes in posture and support. Even the pillow you use can make a bigger difference than most people think. A pillow that pushes the head too far forward can tighten the airway and strain the neck. A pillow that is too flat can let the head drop backward in a way that also affects comfort and breathing. The goal is not softness alone. The goal is neutral support, where the head, neck, and spine stay in a more natural line. The same goes for the mattress. If it sags deeply, the body can twist and compress in ways that make breathing and circulation less efficient. If it is too hard, pressure points can build and cause you to toss and turn all night. Seniors often blame their body when the real problem may be the setup under them. And then there is the issue of arms and shoulders. Many side sleepers curl one shoulder under their body or tuck an arm beneath the pillow. This can lead to numbness, tingling, shoulder pain, and repeated waking. When sleep becomes broken for mechanical reasons like this, the entire body suffers the next day, especially the heart, because poor sleep quality can affect blood pressure, stress hormones, appetite, balance, and energy. This is why the safest sleep position is not just the one that feels good for 10 minutes. It is the one that allows stable breathing, reduces strain, supports circulation, and helps the body stay asleep without constant stress signals firing all night long. And the most dangerous part is that many seniors adapt to poor sleep so gradually that they stop noticing how bad it has become. They normalize the fatigue. They normalize the headaches. They normalize the shortness of breath when lying down. They normalize waking up with a fast heartbeat. But normal does not always mean harmless. Sometimes it simply means familiar. So what should you actually do tonight if you want to sleep in a way that is kinder to your heart and safer for your body? First, pay attention to patterns instead of guessing. If you regularly wake up short of breath with a racing heart, a dry mouth, chest discomfort, headaches, or extreme fatigue, do not brush it off as just age. Those signs deserve attention, especially if they happen over and over. Second, try adjusting your position before bed. For many seniors, side sleeping with good support under the head and neck is often the most comfortable and least stressful option. A small pillow between the knees can also help keep the hips and spine aligned, and if reflux or breathing issues are a problem, slightly elevating the upper body may help more than lying completely flat. Third, be honest about what your body has been trying to tell you. If you need 3 pillows to breathe comfortably, if you fall asleep better in a chair than in bed, if your snoring has become loud, or if someone has noticed pauses in your breathing, it may be time to talk with your doctor about sleep apnea, heart strain, reflux, or fluid buildup. These problems are common, but they are not things you should simply ignore. And finally, remember this. Sleep is not just rest. For seniors, sleep is one of the body's most important forms of repair. The position you choose each night can either support that repair or quietly work against it. A small change in posture, pillow support, or bedtime setup may not seem dramatic, but over weeks and months, it can make a real difference in how you breathe, how your heart works, and how you feel every morning. If this video helped you, subscribe to the channel, like this video, and share it with a parent, grandparent, or friend who still sleeps the same way they did 20 years ago. And before you go, tell us in the comments, what position do you sleep in most often? And have you ever noticed it affects how you feel in the morning? Sometimes the smallest nightly habit reveals the biggest hidden health risk.